There's a reason why I said this question. It has a lot of content, and I'll show you the strategy to answer this question. It's just straightforward. If you follow the strategy, you can see that you'll be able to answer this question without any problem. So let me show you the cause of it. The key word is the cause of bleeding. So this is your bars rate. Always start from the back and ask what is being asked of you, the cause of these symptoms, and what is the case about. Then under the case, look for buzzwords. A nurse is assessing a client who recently delivered. So this is a buzzword. Patient already had a baby. Then the client reports what? Sudden, heavy vaginal bleeding. So she's bleeding after the delivery. Once again, after the delivery. The nurse note that the bleeding is what? Bright red. And there is no visible clotting. That means nothing is coming out. And then the client denying any pain and discomfort. So connect the dot. I deliver, sudden onset, I'm having vaginal bleeding, and there's no visible clot, and I have no pain. If you do that, you'll be able to figure it out. What is going to cause the problem? This is your content. You take one by one. You said, what is placenta previa? Placenta previa is I'm bleeding. It should be what? Bright red blood, right? Bright red blood. It's also not painful. But what is the problem? Placenta previa does not occur after you have baby. You see the concept? You should not have placenta previa after you have delivered. So that content, that buzzword, eliminate this. Second, placenta abruption. Your blood is not going to be bright red blood. It's going to be dark. And what? It's going to be painful. So it cannot be placenta abruption. Next one, uterine rupture. You're going to see cessation of contraction. And it's going to be painful. What? There is no pain here. Therefore, just by elimination, using your content, you know this is cervical laceration. This is the way I want you to do questions. You don't memorize the question. You look at the question they've given you, use the content related to the question, and then use it to break down, knock out each answer choice, and you see that you'll be golden. So this is adaptive NCLEX way of attacking difficult questions. So the right answer is cervical laceration. She had cervical laceration after the delivery. What about this? How often should the nurse monitor the fetal heart rate with a Doppler during active phase of labor? So the key word is what? Active phase. We're dealing with an active phase of labor. So what should the nurse do? The nurse is monitoring a pregnant client admitted to a healthcare center who is in active phase. She's in active phase of labor. So what would you do? How do you monitor it? There's three things you should know about phases of labor, right? There's a latent phase, there's an active phase, and then the transition phase. All of them are very important. The latent phase, even though it's very slow, you still have to monitor and you monitor 30 minutes. In active phase, you have to monitor them in 15 minutes, every 15 minutes. When they get to the transition phase, everything get faster, contraction going faster. So 5 minutes. So this is the content. Transition 5 minutes, active 15 minutes, and latent 30 minutes. So for this patient, the nurse is monitoring the pregnant client admitted to the air care center who is in the active phase of labor. So during the active phase, usually monitor them 15. In a latent phase, you monitor them 30 minutes. 2 hours is too long. Next one. Which method of anesthesia should be administered to the client? This is very, very important. If you know the answer, you can put it, but it requires you to pay attention to words in the question. A pregnant client with the history of spinal injury is being what? Prepared for a C-section. Which method of anesthesia should be administered to this client? That means a patient has spinal injury is going to have surgery. Surgery, which is C-section. What do you think? The key word here is right there. Don't even struggle. Spinal injury. And he's going to have C-section. And we need to give it anesthesia, some form of pain management, so that when we're doing labor, it will be easy. What would you choose to give them? General, epidural, spinal, and local. Content mastering, right? I see spinal and I'm injured, nothing go to your spine anymore. Therefore, epidural, you go to your spine. Spinal, you go to your spine. Local anesthesia is not enough. Therefore, what is she going to get? General anesthesia. I do these questions to show you to be able to like be comfortable when you answer questions. Like I said, content is the content, and adapting class is the home of content. If you want more, you just subscribe, join our membership. You can join our on demand, and we have our on demand at www.adaptingclassreview.com. Or you can join our crash course, which is coming up on the 15th of May to 25th. This is the same thing. Select or apply. Don't be afraid. Pick those you know you're confident. You don't have to pick everything, but pick those that you're very confident. 101. Don't over-select. Okay. Which information should the nurse obtain from the client during for an assessment? For what? A nurse is assigned to conduct an admission assessment by phone for a pregnant client. What information would you obtain? That's all. Buzzword. Let me underline. I always go for the buzzword. The question does not matter. I'm making assessment. What information to obtain? 3 words. That's all. Right? I'm conducting an assessment. What would I obtain? The patient is what? Is pregnant. We want to know what is wrong with the patient, right? And this is assigned to conduct admission assessment by phone for a pregnant client. She's pregnant. 3 things. Connect these 3 things and forget about the rest of the question. What will you obtain? Client due date or obstetric history? Are you going to get that? Their current symptoms, what kind of symptoms they're getting right now? Current last menstrual period, when is their last menstrual period? Any history of STIs, right? History of drug use, is it important? Characteristic of contraction, are they contracting right now? She's pregnant. You're obtaining history. Preferred birthing plan and support person present. Who they want them to be around. What do you think? Obtaining information. A pregnant lady who's coming to have a baby. Yes, I need to know your obstetric history. Previous pregnancy, term, preterm labor, abortion, all those. You got to obtain them. Then the carrying symptoms. What are they having right now? Are they having contraction? If they having contraction, what is the characteristics of the contraction? Have you used drugs before? Right? Substance abuse. Have you have any STDs? Right? Nothing wrong with it. And when was the last menstrual period? So that we can calculate when you should be your due date, right? And then what kind of method you want to use for birthing, right? So nothing wrong with it. Or who do you want to be present? You can see all of them. These are designed to teach you content. These questions is a content in practice question, as I have indicated. So labor and delivery nursing and practice question. So all of this is acceptable to obtaining from the patient. Okay. So those are all acceptable. And this is caring for a client in active labor who is approaching delivery. Which fetal response should the nurse expect, right, during labor and birth? Once again, always read the question once, go back from the back, select or apply. You say, oh, tell yourself, I have a SATA. I'm not picking everything. Which fetal response should the nurse expect? Unexpected finding. I'm looking for expected finding. That's what the question is asking me. And this is expected finding for what? The fetus. And the nurse is in what? Active labor, during labor. You see, I'm writing the keyword. When you take into text, do that. So now I can focus on this and then put down my content. SATA expected finding for the fetus whilst the mother is in labor. If mommy is in labor, what is going to happen to the baby? That's all. What is going to happen to the baby? Fetal heart rate can decelerate. The baby does not like contraction. So that's it's okay. Decrease fetal oxygen pressure. Think about it. If you know the answer, put it down. Increase fetal movement. Put it down. Decrease in fetal breathing pattern. Put it down. Increase in fetal arterial carbon dioxide pressure. Put it down if you know it. Elevated fetal temperature. I can tell you during this situation, the temperature does not change unless there is infection. So baby temperature remains the same. I can also tell you this is a trap. Baby does not like contraction. That's why when contraction occur, their heart rate may decrease. In addition, they will not move. This is a trap. During contraction, there's fetal, decreased fetal movement. So this is a trap, right? So that's a trap there. The heart rate, the respiratory rate may decrease, okay, because of all the things that is happening to them. The oxygen pressure is going to decrease, the same thing. And then as the contraction, there's less blood flow. Their oxygen CO2 will increase as the oxygen decrease. You see, this is the oh, you know them, but in this question form, it feel a little bit confusing. And let me explain it to you. If you look the fetal heart monitoring and where the mommy contraction and the baby heart rate is going like that, yeah, you're looking for deceleration. At the peak of contraction, there's less blood flow. So when there's less blood flow, you can have what? Fetal deceleration. You can have oxygen decrease. You can have CO2 and your breathing go down. They're going to have less movement. Temperature does not change unless there is infection. This is a response. You should be comfortable analyzing it. If you need help, like I said, join our on-demand adapting class or our channel membership, just a small token to support the channel. Which action should the nurse take first, right? The 39-week gestation client arrived at labor and birth unit reporting abdominal pain. Watch this question. Don't get trapped. If you're on the line, listen to me. This is adapting class. This is a content mastering, questioning, answering on labor and delivery. If you know the answer, you can put it down. But 39-week-old lady came in, but arrived at the labor and delivery unit and reporting abdominal pain. What would you do first? Give them pain medication, assess for fetal heart rate and urine contraction, check the cervical dilation, or allow the client to walk around to help the discomfort. What do you think? Prioritization 101. You have to be sharp. Pregnant lady reporting abdominal pain. What do you tell her to do? What would you tell her to do? Give her medication, assess the fetal heart rate and uterine contraction, check for cervical dilation, or let her ambulate. The keyword, I call it buzzword, is what? Abdominal pain. Abdominal pain can mean so many things. Are you in labor? Are you having what? Complication associated with your pregnancy, right? Like placenta abruption, placenta previa, even though you don't have too much pain associated with it, uterine rupture, anything associated with it, I need to figure out. And then since you have the abdominal pain, I get to assess you whether you're okay. So you got to assess my mommy and then check if the baby is doing okay with all this abdominal pain and contraction. Of course, we're going to give you pain medication if everything is normal. Of course, after that, we can see if you dilated, right? And then we can help you move. But the first thing we do, see if the baby is okay and what contraction you're having. These are little adapting class keywords in the question that I try to put in so that you take the NCLEX you see, you don't get trapped. Which sign indicate the end of first stage of labor? Simple, straightforward content. Buzzword is first stage of labor. And then she's caring for a pregnant client in labor at the air care facility. Which indicate end of the first stage. So then you write your content. You said, okay, the end of the first stage. There is stage one, two, three, four. The purpose of stage one is what? What is the purpose of stage two, stage three, stage four? If you want to know, check the previous video I made on this or the content related to labor and delivery or the cheat sheet on the labor and delivery. But what is the purpose of stage one and what do we have to achieve to go to stage two? Do we look for complete effacement of the cervix? Do you look for engagement of the fetal head? Do you check for cervical dilation to 10 centimeters or the rupture of the amniotic sac? If you know it, just put the content down, but answer down. But what do you think? What is the end of cervical stage one? What is the purpose of stage one of labor and delivery? If the mommy has finished stage one, they should have achieved 10 centimeters dilated. They can have effacement 100%, but until they get to what 10 centimeters, you've not finished the first stage. So that's why effacement is not the best way to detect. You can have 100% effacement, but you may be 5 centimeter dilated. So it's not appropriate. The best thing is to look for cervical dilation. A complete cervical dilation is full 10 centimeters so that then we can move to stage two. So this is number three. You see, they are not difficult questions. They require some content. This is also long. All I'm asking you to show you how you can come up with the buzzword and you forget about it. What should the nurse tell the client about Braxton X contraction? A nurse is a pregnant client arriving in the clinic reporting irregular contractions, so it's not a true labor. Upon assessment, the nurse determined the client is experiencing Braxton Hicks contraction. Therefore, so what would a nurse tell the patient? How would it educate the patient? What is the this is a false labor. So it's not a true labor. Therefore, these eliminate this answer choice. You see what I'm doing? I'm showing you if you see long questions, you don't know what to choose, use the words. Braxton Hicks contraction is a false labor. Therefore, if the patient said, and what? The patient is going to say these contractions indicate the start of a true labor. It's not the true labor. This is a false labor. They help prepare the cervix for dilation effacement. Hold on to that, right? It's a false labor, but why do you use it? Braxton Hicks contraction typically causes the rupture of memory. No, it does not do that. This contraction increases fetal movement in preparation for delivery. No, it does not do that. The purpose of Braxton Hicks contraction is a practice run of contraction. So your mommy practice in the process as the baby go up and down, it causes cervical dilation and effacement. So it help with it, but it does not cause it. It prepare it to be ready for dilation and effacement, but it does not cause it. That's why it's not the true labor. True labor always will cause dilation and effacement. Preparing the cervix for dilation and effacement does not mean it causes it. So that's why it's a trap. It's designed to test your sometimes critical thinking about it. Prepare for it, but it does not cause effacement and dilation because it's a false labor. True labor causes that. And therefore, number two is the right answer. And the last question also is a long one. The first time pregnant client asked the nurse why labor tend to last longer for women having their first baby compared to women who had previously given birth. You probably know this. Why does G1P0 takes a long time than G5 and P4, right? She already had four babies, so she's going to pop the baby out quickly compared to somebody who is new. First baby is going to take a while. Why? Think about it. Is it the uterus is less experienced at contracting first time? Do you think it's less experience? First time mothers often delay going to the hospital. Is it time going to the hospital causes the problem? The labor is longer with the first baby because the cervix and the birth canal need more time to stretch and adapt. Is that the situation? Labor tend to be longer the first time because babies are usually larger with the first pregnancy. Is it because of the size of the baby? That's why G1 gravidarian, it takes a long time compared to uh, somebody who already had multiple babies. What do you think? Last question. Try your luck. But I give you the answer. If you see the way I describe it, you'll be able to know that I've given you the answer. Which of these is consistent with the first pregnancy and why it takes a long time? What do you think? If you know the answer, put it down. But this is adapting class. Thank you for joining us. Um, Content mastering, labor and delivery. There's several series I made. If you want to master your content, join our crash course that is coming up, or you can join our on demand, free of charge for videos also on YouTube. But the best thing to know is the phase and the stage one and stage two, um, especially stage one. The latent and the active phase is very long in new mummies. So they have longer latent phase and long active phase. And that make it really, really long. That's why it takes them a long time as the cervix and the birth canal adapt to the stretching and adaptation in terms of effacement and dilation. So that is the problem. So they have a latent and active phase longer. So three is the right answer. That's the main. It has nothing to do with the size of the baby, the time you report to the hospital, and then whether you experience. It's all based on the the time it takes for the stretching. So the latent and active phase is longer. Thank you for watching. Good luck in your exams. Keep charging as always. Never stop charging. And good luck. Adapting class out.